Right. Hello and welcome everybody to the Georgian Fahey Center for Healthcare Innovations, or CHI, a seventh session of the 2024-25 academic year of the Patient Engagement Lunchtime Learning Series. My name is Victoria. I am part of the CHI Patient Engagement team, and I will help moderate the session today as well as the Q&A. A couple of housekeeping items before we get started. This series is accredited by the Royal College of Physicians and Surgeons of Canada as a group learning activity. It may also be eligible for credits towards requirements of other professional bodies. We have auto transcription enabled, which can be toggled on or off at any time using the captions button at the bottom of your screen. Should you have any questions or comments, we invite you to submit them using the Q&A feature, which should also be located at the bottom of your screen, especially once you go in full. This session will also be recorded and available for viewing afterwards, and attendees will receive this information in a follow-up email after the event. For today's session, we welcome Brianna Hunt and Cheyenne Travers. Cheyenne is an Ojibwe mother to one daughter, Lily Travers. Born and raised in Winnipeg, Cheyenne has overcome addictions and homelessness. She works with Graffiti Art Programming, Inc., which is a nonprofit youth organization in Winnipeg, Manitoba, and she sits on the board of the North Point Douglas Women's Center. She has found her passion in community work and sewing, and serving in the roles of research advisor and regalia workshop instructor. Brianna, a proud parent of an energetic toddler, brings specialization in participatory and community-based research methods, and is a patient engagement coordinator at the Children's Hospital Research Institute of Manitoba. In this role, she is passionate about supporting meaningful engagement between researchers, patients, families, and community members. Welcome, Brianna and Cheyenne, and we look forward to hearing about your project.
Thanks so much, Victoria. And thanks for having us. Today, we're going to talk about our project called Art as Knowledge Mobilization. And this presentation specifically will be sharing both process and findings from 6 workshops that we held that were centered on harm reduction and arts-based with young people with lived experiences of homelessness. So Cheyenne and I will both do just a brief introduction. Victoria did an amazing introduction for us. Thank you so much. But first, I like to just situate myself and talk a little bit about my positionality. I am a white person who doesn't have lived experience of homelessness and who moves with a lot of privilege in the work that I do on the land that we inhabit. So I always like to open by expressing gratitude for the first people who have been stewards of this land for time immemorial. So I'm joining from Treaty 1 territory, the traditional territory of the Anishinaabe, the Innu, Anishinaabe, the Dakota, and the Dene people, and the homeland of the Métis Nation. To me, this means that I have a responsibility as someone who inhabits this land as an uninvited visitor to working toward health equity in everything that I do. So whether that's in my role as a community researcher, which is the hat I wore for this specific project, or in my role at the Children's Hospital Research Institute. I really see that as a responsibility that I take really seriously, and I always am open to feedback if there's anything that I say or do that doesn't reflect that commitment to health equity. I'll turn it over to Cheyenne to just share anything that you would like to before we move on.
Hi, my name is Cheyenne Travers. Yeah, thank you for the introduction. I wasn't expecting that. I forgot I gave that introduction, so it's nice to hear that. Yeah, I work at Graffiti Art Programming right now. I'm in school to get my grade 12, and then I'm going to further my education in university, and I'm not too sure what I want to do next, but it's definitely involving the community and helping revitalize our culture. And yeah, I'm excited to present our findings. I have the zine right here, just so I could look at it and look at the art. And yeah, since nobody has the art, I want to show it a little bit. Thank you.
Thanks so much, Cheyenne. So for the presentation today, we hope that you will walk away with several principles of youth-focused harm reduction. We hope that you'll be able to explain some of the benefits of engaging young people, specifically using arts-based methods. We hope that we will convince you that it's essential to center ceremony and Indigenous research methods when working with Indigenous young people, whether that's First Nations, Métis, or Inuit people. And then we hope that we'll be able to more ethically and thoughtfully engage young people with lived experience as members of research teams. So this project was a partnership between Laurier University in Waterloo, which is where I did my graduate work. So I still have colleagues there, so that's where our funding was held. But we did do the workshops here in Winnipeg in partnership with the Manitoba Harm Reduction Network and Graffiti Art Programming, which is a nonprofit that works with young people to provide opportunities for engaging in arts and well, Cheyenne knows a lot more about that, so she can talk about graffiti art programming way more than I can. And we were funded by Making the Shift, which is a social innovation lab that specifically looks at preventing youth homelessness. We had a broad project team, so the project team was made up of peer advisors, of which Cheyenne is one. Our knowledge sharer was Elder Leslie Spillett, who provided ceremony and guidance for us throughout the research process. We partnered with academic researchers Sian L. Wilson at Laurier and Bronwyn Dubchak Land, who's in criminal justice at the University of Winnipeg. And then we had a whole bunch of community researchers, so myself, Linda English, Shauna from the Manitoba Harm Reduction Network, Jody, who's a registered social worker, and then Quinn Soretsky, who has her Master's of Indigenous Governance. So really, this was a broad and multidisciplinary team that brought together a lot of different expertise. We like to start out by just talking a little bit about what we mean by harm reduction. So this is the definition of harm reduction that's given by the Manitoba Harm Reduction Network. And so what harm reduction means to us is looking at a big picture, looking at systems and policies that cause harm for people who use drugs or engage in other risky behaviors, and working to change those systems that cause harm. So we recognize that criminalization and the war on drugs have been historically harmful, specifically for Black, Indigenous, and other racialized communities, and that dismantling these frameworks is a key piece of harm reduction. We understand that harm reduction is a process rather than just a one-off kind of service provision, and should involve peers, policymakers, healthcare workers, researchers, activists, and that it needs to be community driven. We also recognize harm reduction as that practical set of strategies and tools, like providing different safer ways for people to engage in activities that could have risks. And when we talk about youth-focused harm reduction, we're drawing on the latest research that really indicates that harm reduction services are critical for keeping youth alive and healthy, and that they should be offered at every opportunity, whether or not youth or young people are interested in minimizing or stopping substance use or engaging in risk behaviors. And we also recognize that all harm reduction strategies that are evidence-based, that are available to adults, should also be available to young people and should be tailored to be developmentally appropriate. These specific principles come from this article from Pediatrics from 2021, just called Principles of Harm Reduction for Young People Who Use Drugs. So when we talk about harm reduction services and supports, we mean a lot of the things that people often associate with harm reduction. So like condoms and lubrication, safe sex supplies, needle exchange, those are the services and supports that we're referencing. But when we talk about a harm reduction orientation or approach, we really mean approaching any kind of support work or care by taking the time to realistically assess what harm is going to be caused by different options, and then choosing the option that results in less objective harm or risk of harm for the young person. we are referring, when we talk about this orientation, we really mean meeting youth where they're at rather than where we think they should be, and questioning any policies or standard operating procedures that seem to result in greater exposure to risk rather than minimizing harm for young people. So we reference a harm reduction orientation or approach, and we also reference services and supports, and that's really what we mean by those two different things. So what informed this research project? I started this project when I was working at a large youth serving organization that supported youth who were experiencing homelessness or at risk of homelessness, or also systems involved, so justice or child welfare system involvement. And what me and my colleagues were seeing a lot was that the youth that we were supporting were becoming homeless or were sleeping rough or couch surfing because the places that they were calling home were not using evidence-based harm reduction policies. So the best way, I think, is just to give some examples of that. So for example, we were seeing a lot of youth sleeping rough because they weren't allowed to stay at their group home or their foster placement when they were drunk. So they would sleep outside instead. Or we were seeing young people who wanted to spend time with their partners, who maybe they were in a group home where they weren't allowed to bring their girlfriend or boyfriend or partner over. And so they chose to sleep rough so that they could engage in that developmentally normal behavior of just spending time with the person that they're dating. So we saw very clearly this link between housing precarity and child welfare, and that what was happening was young people were actually being exposed to greater risks. So the risks that come with sleeping rough or couch surfing are not being housed because the placements that they were in were saying that it was a safety concern for them to, you know, whatever it was, use marijuana or have cigarettes on them at their home. That was a safety concern, but then they were exposed to far greater risk in the community sleeping rough. We also saw, of course, a huge overrepresentation of Indigenous young people in homelessness and in deaths from drug poisonings. And we wondered, can a harm reduction approach create change? So the research questions very broadly were, how do organizations that support youth use harm reduction? So what's currently happening in the environment? Who is working from a harm reduction perspective? What exposure to harm reduction supports or approaches do youth with lived experience of homelessness have? And what can they share about how harm reduction might better support them? And then finally, how arts-based methods can mobilize the voices of youth with lived experience and inform harm reduction policy and practice. Some of the theory that informed this work was Indigenous cultural responsiveness theory, which is from Sasakamose. And that just states that all services provided and all research done with Indigenous youth should be spiritually grounded, strengths-based, community-specific, and trauma-informed. Then we also were very familiar with Research as Ceremony by Sean Wilson. So we really, it was very important for us to bring ceremony into that space, and we did so in collaboration with all of our Indigenous team members and then our knowledge sharer, Leslie Spillett. And then we were committed to the 5 R's of Indigenous research. So respect, relevance to community, responsibility to community, reciprocity, and relationship. And then for the methodology, we know that arts-based methods are particularly impactful in work with young people. So from one of our investigators, her background is all in arts-based research, and this is a quote from a project that she did with Sarah Flicker before, where youth participants evaluated the process of making art, and they viewed it as fun, participatory, and empowering, feeling that their art pieces instilled pride, conveyed information, raised awareness, and constituted a tangible achievement. Youth participants found that both the process and products of arts-based methods were important. And because we knew that we wanted to do this work with young people with lived experience, we knew that we wanted both the process and the product to be important. So our emphasis was on process as much as it was on the data collected. And I'm gonna now turn it over to Cheyenne to talk a little bit about the workshops and the methods of our work and what we did. And I'll just jump in whenever you'd like me to, Cheyenne.
So starting last June, we held 6 workshops every Saturday at Graffiti Art Programming. We provided meals, bus tickets to and from the workshops, and honorariums. We had 10 to 11 youth show up every Saturday, and they asked on the first week if they were allowed to come back the next week. So we ended up having the same youth come back every week. So we really got to like build on the relationship and get to know them so that they're able to open up to us, which was really nice. For our first workshop, we had a pipe ceremony with knowledge keeper Leslie Spillett. Having there, having her there to open up our workshop with ceremony and a sharing circle helped everyone feel comfortable. We had a sharing circle and made medicines available to those who wanted to participate in smudging. Most youth expressed that having the medicine there helped them to open up, but one youth expressed being hesitant, having been raised in CFS and not having access to her culture. So, yeah, just hearing in her words that she's never been around medicine before, it really left a mark on me. Our 6 workshops consisted of different artist names. Oh, I think that's the next one, next slide. Oh no. Go ahead, Brian.
I can speak to this slide quickly, Cheyenne, and then you can
ahead.
talk about the artists. I think I might have messed with the order a little bit, so my apologies.
No worries.
So during the workshops, the way that we tried to incorporate these principles of cultural responsiveness and the 5 R's of Indigenous research were by approaching all of the youth participants with unconditional positive regard and always assuming the best, letting youth take the lead of discussions and topics and subjects, and then remembering who we're working for, and it's the youth. So even if myself or one of the professors, for example, really wanted to get to a specific question or wanted to get something done during the workshop, we really didn't prioritize that. That took a back seat to remember that we're always working for the youth. And then we really honored the expertise and the time of the youth by gifting a generous honorarium, and then developed relationships and continued support. So we still keep in touch with the youth who are part of our workshops to do ongoing member checking, to keep them apprised of what we're doing with the results, let them know that they're always welcome to provide continued feedback. And then we also make sure to always frame our work within the systems that are built to disadvantage Indigenous peoples, provide access to mental health supports. So we had an elder throughout who could provide support as well as social workers on the research team. And then always holding space for hard topics. So saying like, hey, today we're going to be talking about something really difficult. Just a heads up, if you want to take 7 smoke breaks, that's totally fine. Like giving those opportunities for space. And now I'll turn it back over to Cheyenne.
So what we did, we had ceremony and guidance, opening ceremony, medicines were always available, facilitating connection between young people and spaces, places for them to do ceremony, and closing ceremony at the end of it, at the end of the workshops. So we had multiple artists come in. Our first artist, Kisa McIsaac, Kelly Grubb, Kat Nancy, and Jackie Travers. Yeah, creating the scene. So we took the art. Some of the youth took, I guess, facts. What do you call these again? What do you call these things? A scan?
Yeah,
played,
just the scans. They did like
yeah.
old school zine style scanning.
Yeah, they played with the scanner. We took some of their quotes, plaster scene. Yeah, we had a bunch of different art methods going on. Every week was something different. It was nice. Got a bunch of different expressions through all these different methods of art. This is us creating the zine at Brianna's house. This was fun, looking at all of the art created throughout the 2 months. It was a lot. We did include almost all of the art. Hey, I don't think we left out any art. We made sure to put anything that was colorful and had some kind of personality on it. We made sure to put it in there, found a place for it. This was nice.
Yeah, so we wanted some way to capture a lot of the art that was created throughout the workshops in one place to share it. And so we created this zine where, yeah, we took all of the art and then photographed it or scanned it in, and we created hard copy zines. So that's what Cheyenne has right there, and we got a bunch of them printed. We also asked the youth if they wanted to say anything about their work, and then we put their quotes in it alongside the art. So this picture is just a snapshot of us literally in my basement, like laying everything out to create the zine all together.
So we hosted a community event to share the story of the project with community members, invited all youth participants to follow up and hear their reflections, collected feedback on draft 1 of the zine for a second draft. Community events. This is a wall where we hung up all of their art. This is Leslie Spillett giving an opening prayer. And then this is a group photo of the whole team. Nice. Yeah, you could take it away on this one, Brianna.
Sounds good, thanks. So after we had our first community event where we invited a bunch of different people from different spheres to come and hear about the project, we also did a thematic analysis workshop together as a group. So all of the workshop discussions from the 6 workshops that we did with our youth participants were transcribed. And then the research team came together and did a 3-day collective data analysis workshop where we identified main themes, and we created a collective code book. And then right now in progress, we're doing a more fulsome thematic analysis using NBIBO. But we're working from that code book that we did all together as a research team. So with the peer advisors, the professors, all the community researchers, and Leslie, our knowledge sharer. So these are some photos from how we did like the coding to come up with our code book during our data analysis. And then this is the team just sitting together and doing some of that work. And then some of the results that we can share, the initial themes that came out around how we built our code book. First, the strengths that we identified that youth shared were that any access to the outdoors, land, and nature were really, really big strengths that connected them and made them feel really empowered. We recognized that a huge strength of the youth with lived experience was peer-to-peer knowledge sharing, especially in absence of having harm reduction orientations in their places where they were accessing services and supports. There was a lot of peer-to-peer knowledge sharing and a big emphasis on keeping each other safe as young people. A lot of knowledge and skill seeking, so young people really wanting to find freedom and independence safely and working on building their skill sets, even when they weren't necessarily positioned to do so by the systems that were supposed to support them. And then some of the experiences of harm that were shared were this theme of being kicked out kind of over and over again and exclusion based on that. Themes of grief and loss in the community, lots of systems failures, which I'm sure doesn't come as a surprise to folks. and then harms experienced from substance use, especially in this kind of moment that we're in right now, where we're seeing a lot of drug poisonings and kind of a movement away from harm reduction approaches, specifically for youth. And then I also did want to point out that our only inclusion criteria for participants was that folks had were between the ages of 16 and 24 and had lived experience of homelessness. We did make sure when we were recruiting people that they were not currently homeless. And that's just because we wanted to make sure that if folks were experiencing homelessness, that our first priority was connecting them to resources to get them housed rather than engaging them as research participants. So those were our only criteria, but it will come as no surprise that actually all of our participants ended up identifying as either First Nations or Métis, which just demonstrates the overrepresentation of those communities in youth homelessness. And then also all of our participants had some connection with child welfare systems. So whether they were currently in the care of CFS or they were in the care of CFS when they experienced homelessness. Here are some examples of the art that we created. So a painting that someone did, and then a drawing and another, like this is like a hybrid, it's like a painting, but it's also glitter artwork, which is really cool. And as you can see, like tons of them have this overlaying theme of land, nature, and access to the outdoors. So some of the quotes, when we said freedom and independence came up in kind of a nuanced way in the workshops, because at once youth experienced what they felt was too much independence. So like this, I basically raised myself the entire time. So all of this stuff that's talking about supports and other housing stuff, even the sexual ed thing, I haven't accessed these clinics at all. So people spoke to, you know, I was given too much independence too young, but there was still a desire for freedom and independence in a safe way, like in a developmentally appropriate way. So this is what I want in my life, things that I've created, things that we want and need. And I think that, I guess, we're all people and we're all real and we exist. There was also a theme of folks recognizing that there's a lot of denial around substance use for youth, and a lot of people don't want to really look at it, and a lot of approaches are still abstinence oriented. So some of that peer-to-peer knowledge sharing, we asked during the discussions, what harm reduction supports help you to feel safer? And they said accessing those supports through programs and workshops like this to better understand what I had experienced and what others had experienced as well. And that's something that came up again and again, especially when we did the like reflection ceremony on our last day. Folks said being in this space with our peers and other people who share those experiences really helps us to build our skills in a way that other things can't. So it's really a unique environment. Then the theme of being kicked out. This was quite a heavy one and people had lots of stories to share. So they referenced throwing youth at the crisis response center just because they can't handle them. And someone else said, I don't know, for my community, I can't believe that my own principal knew I was homeless and still kicked me out of school. Yet that was my only safe spot, my only place to get lunch. I don't know, everyone just kicked me out. And that was something that we heard many times. When we asked some questions like, what do you wish housing workers did differently, or what would you change about your experience? Folks said things like wraparound support, having a worker that can do wraparound services, if something were to go wrong, if they're living on their own, still helping them out regardless of whether or not the program has ended. So for folks who experienced homelessness when they were in that transition age of like 18 to 21, kind of like maybe aging out of a group home into independent living, feeling like as soon as their program ended, their supports ended as well. And there was that really unnatural end to the supports. And then, yeah, again, system failure stuff. And this one really connects to that harm reduction orientation. So when I was younger, CFS were trying to take us, meaning like the kids, all of the time because my mom had an addiction. But then when I actually needed CFS, they didn't want to help me. They turned me away, saying that I was just going to them for money. I lost my job because I was homeless. I didn't have a way to work and get to and from work. So I can't believe CFS turned me away. I was literally hungry. So just that reflection on how the systems deal with substance use in a really abstinence focused and punishing kind of way. And then folks spoke about how they went from placements to being at risk of homelessness or precariously housed. So when I first came out here, my old placement got shut down for their harm reduction. They were giving us a gram a day. So what do youth workers need to know about how to be better supports to unhoused youth? And they said understanding their perspectives on what they have to deal with being homeless, having to struggle for food, struggle for a roof over their head, or struggle just to survive. And then we'll share some process reflections too. So I'll share a little bit about the process reflections, and then I'll turn it back to Cheyenne to talk about some of the things that we've done with our findings and where we've been. But some of the reflections from our process, folks shared that the impact of ceremony in the space was really powerful and helped them to feel very safe and at home and safe to be vulnerable and share their experiences really openly. They really appreciated the reciprocity of our engagement, so making sure to respect their time and offer a generous honorarium. And then there was a lot of reflection on the power of connection in the space. So we saw at the beginning of the workshop process, maybe on the first and second day of the workshops, folks kind of kept to themselves or they spoke to one or two people. And then by the end of the workshops, folks were really connecting. The participants were helping each other with things, sharing, exchanging contact information, and building relationships. And that was a really beautiful thing to witness. Folks really enjoyed the role of art making in our work. It did facilitate some of the discussion. So when folks would make a piece of art and then share it with the group and say, this is what this meant to me, or even just art making together. So we did one session where we did stop motion animation video, and a lot of the youth worked together to film short videos. And that really facilitated connection as well. And then we also see, reflecting on the process, that there's definitely a potential to expand the workshop model and hopefully to share it, you know, beyond the research world and further in the research world as well. So I want to share some learnings from the process because even though this was a really beautiful project and we went into it with so many good intentions, there were still harms that were caused. And I think that's really important to point out. I could honestly do, and actually we have, some of the peers and myself have done a full presentation on some of the learnings on ethical engagement with lived experience advisors, but I'll just speak to it for a few moments. So we really learned from the process that when engaging with peer advisors, it's really important to approach from a trauma-informed perspective at each stage of the engagement. So we found that some of the tasks that we asked the peer researchers to take the lead on, for example, transcribing the workshops, was very challenging for the peer researchers. And I share this with full permission, but one of the researchers on the team, as they were going through the transcripts and listening again and again to the reflections of the youth, it was really triggering for them. And it brought up a lot of their trauma that they had experienced in their own experience of homelessness. And so thankfully, we did have safety in our relationship and we had engaged in a lot of trust building that when they experienced this harm, they were able to come to the broader research team and say, hey, this task is too much for me. What can we do? And we had another team member, like the research coordinator, was able to finish the transcription for them. But it was just a reminder that those things are really important to review, and we should have had more in place that to ensure that if that happened, there would be a really seamless transition where someone else could pick up that work and they could do a different task. So just reminders that initial engagement with peer advisors needs to be really transparent, and you need to say, we will be touching on difficult topics. How do you, like, where are you at in your healing? How do you keep yourself safe when engaging around these topics, and what can we do to support you? And then building a lot of trust, having accountability and reflection. So when that team member came to me and said, I'm experiencing harm from this, and came to the project coordinator, we said, wow, that was our bad. We really should have put A, B, and C in place. We're so sorry. That is our fault. Absolutely, we'll reflect on that and make changes for the future. So accountability is really important for all members of the team. And then making sure that you're approaching with an understanding of trauma, and that it can be really complicated, and it can come up even when folks feel that they're not anticipating it to. And then having a compassionate approach is really important as well. Some of the other learnings from the process have more to do with some systems and doing some systems advocacy, which I'm sure a lot of folks who are listening today have experience with this, but it can be really frustrating working with systems who aren't familiar with the value of lived experience advisors or the value of peer researchers in the research process. So we did unfortunately see a lack of support for peer involvement for things like conference registrations, even when folks said that they really supported our project because it was peer-led and it was youth-centered. They would do weird things like offer to cover the airfare and travel expenses of our PI for a conference, but none of our peer researchers, even though the PI is probably the only person on the team who makes enough money to cover their own airfare and expenses for a weekend conference. Like, it really didn't make sense. And we did try really hard to push back on that and do a lot of advocacy. Our PI did say, could you please use the funds that you've set aside to cover my expenses to cover our peer researchers' expenses so that they're able to be centered in this process? And they said no. So that's wild to us for organizations specifically that are looking at youth homelessness, but we still do face a lot of barriers like that. And then a lack of understanding of the practical nuances in community-based research. So for example, like, even though our PI was at Laurier, the project was done on the ground in Winnipeg, and I was the on the ground lead, but they wouldn't loop me into any of the communications because I'm not a professor. So because I don't have an appointment at a university, they would communicate just with our PI and not with myself or any of the peers, and that led to a lot of miscommunication and a lot of missed opportunities for our team. So that was frustrating to say the least. And that's just a reminder that we have to be prepared to do a lot of that advocacy, and sometimes it makes us want to pull our hair out. So I'm going to let Cheyenne share a little bit about what we've done up to this point for our knowledge mobilization. A really important thing for the group was that our knowledge mobilization was led by the peer advisors whenever they wanted to. So without any pressure, but it's important for those opportunities to be shared. So I'll let Cheyenne talk about these presentations and such.
So in December, me, Brianna, Sunday, Jaden, the whole team did our first presentation at the End Homelessness Conference in Winnipeg. In February, all three of us again, and Brianna, and I feel like there was someone else there, Jody, came to support us in our presentation at the Manageable Harm Reduction Conference. And then, what's this one? Sorry, I can't see it. In February, I went to Toronto for the International Youth Homelessness Prevention Conference, where I presented with Sian Wilson, professor. So we created posters. That's the one that Brianna and Sunday went to, the International Meeting on Indigenous Child Health in March of 2025. We created the zine. We've handed them out at almost every conference we went to, at the Canadian Alliance and Homelessness National Conference in Ottawa that me and Brianna went to, October. And coming soon is a podcast that me, Brianna, and Sunday will all be on, the manuscripts, community report, and social media toolkit.
And then what's the point? So our goals, we definitely want to inform and change policies surrounding harm reduction approaches for youth. We want to end this kicking out, right? We want youth to be safe where they're housed rather than being at more risk because their housing doesn't take a harm reduction approach. And then we want to support initiatives that reduce youth contact with systems, especially for First Nations, Métis, and Inuit youth. Our dream is that all youth serving organizations in Manitoba and beyond are educated on evidence-based harm reduction approaches and implementation planning. Because what those of us who have worked on the ground, like Cheyenne and myself, and some other team members have seen is that even when organizations will be trained in harm reduction, it often stops at like giving out condoms. And there isn't a lot of implementation planning for what if your organization or your program sets a policy that CFS then challenges? You know, how do you advocate around that? How do you plan to implement these things? Because it definitely can't happen overnight. And then we also want to see harm reduction capacity building for youth. So when we did those workshops, we had a team member from the Harm Reduction Network come and explain, like, have you had access to harm reduction? This is what it looks like. This is what it could look like. Because we recognized that we couldn't ask youth to reflect on harm reduction if they hadn't ever been exposed to it. So it was important for us to have kind of that those two pieces at work in the workshops, so the capacity building and then the data collection and reflection. And then actually suggested by Cheyenne's mom, Jackie, we would love to see the workshop series continued with some more traditional forms of activities for youth, like skirt making or drum making, where youth start a project and then have these discussions while they're working on that with the same capacity building and harm reduction framework. And I know, Cheyenne, you always like to say thank you to the youth too. So I'm going to let you also speak to that.
Sorry, you froze for a minute, so I was like staring at your, yeah, you're
Oh,
frozen.
can you hear me again now?
Yeah, you're good now.
Okay, I got a little thing that my connection was unstable, so it must be my new computer or the network connection here at the office. But we just want to say thank you to all the youth, and I just wanted to turn it over to Cheyenne because she always has beautiful things to say about the youth before we take some questions.
Yeah, I want to say thank you to the youth because without the youth, obviously we wouldn't have this research to share, and just the stories that we heard from the youth, it really makes me see myself in them, and how if they could have a piece of their culture with them, like their lives could be so much different. I'm 32 years old and I'm only just starting to learn things about my culture and learned how to make my own regalia. So that's something that's really important to me because these youth are they want to learn their culture. They want access to it. We just have to provide those supports for them. So thank you to the youth.
Cheyenne. I'm going to go ahead and stop sharing so we can answer questions and look at our facilitators.
Wonderful. Thank you both so much. So we've already got a question come in, and you're all welcome to continue submitting them as we discuss here. We've got about 10 minutes. So the first question is, how did you recruit the youth that participated?
Great question. I clicked answer live. I don't know if I need to do that.
No worries.
But we did really natural recruitment. So we created recruitment materials that were, approved by Laurier Ethics and stuff, and we circulated those via our partners, so the Manitoba Harm Reduction Network and Graffiti Art Programming. But a huge part of it was just word of mouth. Like a lot of our team members were really connected in community, and had a lot of experience doing youth work. And so we just spoke to people that we knew. And I would say about half of our participants came because they saw our like Instagram advertisements. And then about half came because they knew one of the social workers or support workers on the team. And so they felt comfortable to come.
Awesome. I have my own question as well while we wait. So how was the activities fully planned out? Because the project already had funding, was there no wiggle room to kind of like adjust as you went, or did you do that throughout?
Yeah, we actually kept everything really open. So in our funding proposal, we said that we would provide access to art supplies, and that all of the art produced would be youth-led, and that we would invite artists who showed interest in collaborating. So we could make any change. Like it was just really flexible, and we just took the lead of the youth. And then we didn't have Cheyenne and Sunday and Jaden, who are our peer research advisors. When we applied for funding, we didn't have them on the team yet. So we really didn't plan a lot out until they joined the team. And we said, like, what do you want the workshops to look like? The one thing that we did plan that we didn't have wiggle room on was that we had someone from the harm reduction network come and do the harm reduction facilitation. But they're an incredible youth facilitator. Their name is Erica. They've been doing youth facilitation in Winnipeg for decades. And they took the lead of this. So they would start every session by asking the young people what they wanted to talk about. So I would say everything was flexible.
That's great. I don't see any questions coming in. So my last question is, can anyone get a copy of the zine?
Yeah, I can bring you guys the zine for sure. We should also talk about, we have a few copies left, and we're hoping to circulate them to youth serving organizations. We didn't anticipate, I guess, like when we took them to conferences, social workers and youth care workers and doctors would take them to their office. So we know that they've been a lot of places because people would come and take like 50 with them from the conference. So we actually didn't need to do as much like dropping off of the zine or circulation as we thought we would, because naturally people like took it. But I think we do want to do a big drop off to like Ray soon, I think. But I have zines, so you can come and find me.
That's awesome. Maybe if anyone is interested that's still watching, you can come by CHI if you want to take a look at one. All right, so I don't see any more questions, so I will just take a moment to close us out. I just want to take a moment to thank you both, Brianna and Cheyenne, for coming today, for sharing your project, your experiences, and being so open about the questions that we have received. And also thank you for all our attendees today. You will all receive a follow-up email with some information on how to access the recording and the slides. And we also welcome feedback for this session, which will come up as a prompt to complete a short survey once this webinar is closed. So thank you all again, and I wish you all a wonderful day.
Thanks so much.
Thank you. Bye.